Good afternoon and welcome to the PVCC Healthcare Career Chat. I'm Andre Luck, the Director of Career Services at Piedmont Virginia Community College, and I'm really happy to welcome my guests today, which are Charles Bodden, who is the Senior Director for Talent Acquisition and Retention at the University of Virginia, and Trish Henry, Director of Operations 2 at Sentara Medical Group. If you are attending as a student and you have questions, please put them in the chat, and we will be looking at the chat later on in this sequence. I'm going to start with you, Charles. Can you tell us a little bit about what you do in your current role?
Yeah. Thanks, Andre. First, thanks for having me. Appreciate this opportunity and being able to discuss a little bit about UVA Health and UVA Medical Center specifically, and the different services we offer. So thank you for putting this together. Currently, I am the Senior Director for Talent and Retention with UVA Medical Center. I've been in the role for a little over 11 months now, going on my 1-year anniversary on the 27th of this month. So I'm proud to say that I've made it through my probationary period. Pretty happy about that.
Congratulations.
Thanks. My role, as Senior Director of Talent Retention is to first help to make sure that we have a solid hiring process and use that process to bring in talent and qualified candidates into the health system to make sure that we're taking care of our patients with quality healthcare. So that's kind of the biggest part of my role, is to make sure that we have resources, we have all the tools necessary to provide, to bring in quality staff. The second part of my role, which you hear in the title is retention, is to partner with leaders and everybody within, the medical center, UVA Health System network, as well as the community, to work on retaining top talent. So our goal is to be, staffed properly, staffed accordingly, because at the end of the day, we want to ensure that patients are first and that we're able to take care of them.
So Charles, do you work exclusively with UVA Health, or do you work with the academic side as well?
So thank you for asking that, Andre. So quick clarification. So UVA Health actually encompasses more than just the medical center. So I work with UVA Medical Center, which is the hospital system. And then you have UVA Health, which encompasses School of Medicine, School of Nursing, UPG, School of Wise. So there's the UVA Health System, which is the big, 5 pillars. But I specifically, my team works with the medical center, and then all that kind of falls under that umbrella.
Okay, thank you. And Trish, what exactly is the Director of Operations?
Oh, good question. Well, a Director of Operations is the person that the physician's offices or the specialty care center offices would report to. So my job is essentially to support the managers in all of the offices, as well as support our providers, whether they're a physician or a nurse practitioner, a PA, or our medical assistants, and make sure that they have the resources to carry out the vision that we have at Sentara Health for taking care of our patients.
Okay, well, thank you.
Yeah.
So tell me a little bit about your career journey, Charles. How did you get to where you are today?
Wow. So I won't bore you with all the details, all of the slow dragging details, but kind of high level. I've been on both sides of healthcare for several years. So when I say both sides, I've been on the insurance provider side as well as the patient care side. I initially started my career in sports, actually, working with, I don't even know if this league's around anymore, but Arena Football League years ago back in Arizona. So I interned there and then got a job in marketing and operations, running events, running football games and things of that nature. So through that, I was actually introduced into HR. So that is where I got my initial taste of hiring and then what it takes to kind of be an HR generalist. From there, I got into education. So I was a director of operations for a charter school in Minnesota for a little while. Did that for about a little over 3 years. And then moved into staffing companies, staffing agencies, things of that nature. That unfortunately was right around when the economy dropped back in 2005, or 2009. I'm sorry, 2009. And last one hired, first one hired, as they say. So I was a small team in a small office, and they combined two and let me go. But that, I think, there's a reason for everything, Andre. Everything has its purpose, and everything has its reason. So from there, I got hired into Humana, which is a Fortune 100 company, one of the big four when you talk about insurance providers. So Aetna, United Health, and Humana. So I worked there for 10 years and really dug into HR. Worked as an analyst in HR, worked as a consultant with the leaves team. So we did ADA, FMLA, short-term disability, long-term disability, all those fun things. But then had the opportunity to get back into recruiting as a manager. So I was a manager with Humana for 6 years, and moved to Indianapolis, Indiana, and then was founded by, UVA Health found me while I was out there. And that was my first taste of patient care, being on the hospital side of things. Loved that. Was a great opportunity. Learned a lot about the system, about what it takes to run a massive hospital system. And then the pandemic hit. The pandemic hit in that early 2000. And my father, and this all leads up to how I got here at UVA, but my father got sick, who lived here in Virginia at the same time. And I decided I wanted to move to be closer to him. And as I said, things happen for a reason. So UVA reached out and found me after about 1.5 years with UVA Health, found me and told me about this position as Senior Director of Talent and Retention. And everything worked out. And I was able to, relocate to Virginia and then continue my career in HR and helping people and change their lives, as well as being closer to my family, which helped change my life. So I think people that find their way in HR, Andre, I think HR finds them more so than you finding HR. But I think it's for, those people that get into HR really love helping people and love problem solving. And I think being in a position where we can not only impact healthcare and making communities healthier, we can also help our team members, live better lives and be successful in their careers. So it's a little bit of my journey.
It's quite a journey. And what you don't know is that I used to have a career in human resources, and I used to work at UVA in human resources.
Full circle. Everything
exactly. Comes back. And it is true, just hearing you talk about your life experience, sometimes what seems to be a really bad situation actually ends up helping us to move to the next step, which is a better opportunity. Absolutely.
Because you never know, what that opportunity is going to present you. In this case, it was a better opportunity for me, Andre, and I've loved working here at UVA. Everybody here is extremely passionate. And I know Trish can say the same thing. People in healthcare are passionate right now about the work they do. So I think we are a unique breed of individuals, but those that are in it, for a reason. And we want to see healthcare and people just do well with their health. So.
Great. And I also say that because I want the students who are listening to know that just because you hit a bump in the road doesn't mean that your life is over, your career is ended. But sometimes it is also a motivator to get us, like I said, to that better opportunity, because sometimes people are complacent. Well, I'm familiar with it, I'm used to doing it, and, why move? But there are better opportunities that are out there.
Mm-hmm.
Now, Trish, from what I understand, you are a PVCC graduate. So I'm really interested in knowing, what role did PVCC play in getting you to where you are now?
That's a great question. And I would like to say to Charles that part of my background was in physical therapy, and I used to treat arena football players sometimes. So, okay. We may be of the same, the same ilk here, so this is good.
That is.
So PVCC came into my career journey at a later point. So I'll backpedal a minute for you first and let you know that I had received my associate's in applied science as a physical therapist assistant when I was 21. And I lived in upstate New York at the time. And after I graduated, I worked there a year and a half to establish myself a little bit. And then I moved to North Carolina. And I stayed in North Carolina for 12 years. And during that time, I had wanted to go back and complete a bachelor's. So I went and took some classes at UNC, and I had wanted to go back, I know, right? Go back and get a bachelor's in physical therapy. And so I completed classes there. Some of them, were tough to do. It was on campus at the time. There was no virtual. I was working a full-time job. I went for a while, and then I transferred to a community college in North Carolina for some additional credits and classes there. Meanwhile, my career was on a trajectory where they were challenging me with some more responsibilities and some more opportunities for growth. And that's where I came in touch with the administrative side of healthcare. So I was still a practicing clinician, but I was also promoted to a clinical coordinator, and then a manager, and then eventually a manager over 3 clinics in the Charlotte region. Life was going on, as it does, and had children, and I kind of crossroads with a family member's health condition that is very unique and specific. Centers across the country are able to treat it. One of them was the University of Virginia. So we made the decision as a family to move to Charlottesville after looking at, services that were offered at Duke and services that were offered up at the Cleveland Clinic, and we decided on Charlottesville. So that's how we got to Charlottesville. Meanwhile, I was able to transfer with, at the time it was Health South, and it's now called Encompass Health, and it's over at Fontaine Research Park, and continue working. And here, instead of 3 clinics, I only had 1. It was a large clinic, but it was only 1 clinic for therapy services. At the same time, I always wanted to continue and get my bachelor's degree. So I looked into being able to go to UVA, but I didn't have proper credentials, if you will. A lot of my education was science-based, and I needed more business classes to be able to do that. So that's where PVCC and I first met, was taking microeconomics and macroeconomics and accounting 1 and 2 and all kinds of good. You're shaking your head, Charles.
That's right.
You'll get through it, folks. You'll get through it. I promise.
Yes, you will.
And so then after that, I was able to transfer to University of Virginia's Bachelor of Interdisciplinary Studies program, the BIS program, which is an adult program. I was by far not the oldest nor the youngest person that had decided to pursue their bachelor's degree. That was in 2013 is when I received that. And so I was an adult at that point, had a family, kids in high school, the whole 9 yards. And then I still wanted to learn more, and I wanted to know more. I thought it would help me not only in my career path, but answer some of the higher level questions and theories that I had. So I ended up leaving Encompass Health in November of 2019. And you want to talk about a risk or a jump, a leap of faith. I was enrolled at Mary Baldwin's MBA and Master's of Healthcare Administration dual program. And so in January of 2020, the fateful 2020, I embarked on a full-time MBA and MHA graduate program, while I still continued to work some PRN. as a therapist this time without any administrative or managerial responsibilities. So once I graduated, I had some ideas about what type of role I wanted to take and kind of going to the next level in my career. And a director level position was certainly in the path for what I had wanted to embark on. So that's kind of a long story short. Things changed in 2020. So the entire pandemic, I was a full-time grad student working, in healthcare. It was quite an experience. And I know you guys probably have some questions about that later on, but yeah, I've been here 6 months, so not terribly long. And Sentara has both the physician services, and that's the side that I'm on, versus the hospital services.
Okay, well, both of you are relatively new in your positions here in Charlottesville, so congratulations to both of you. And Charles, I guess I can say to you as well, welcome to Charlottesville, although it's been 11 months. And Trish, you said something that I just want to emphasize. You started at PVCC as an adult, and that is not unique to PVCC or to community colleges, because we really have a lot of non-traditional students at PVCC, and we really want to help become that bridge to the career or the bridge to the bachelor's degree or even higher. So I'm glad to hear that perspective that you shared as well. Now, I'm really curious. Charlottesville is 10 square miles. We're very, very small. And we happen to have 2 wonderful healthcare facilities in the area. Not a lot of places this size can boast of that. I'd like to know, how are you different? Are they in services or resources, level of care, the types of customers you serve? And I'm going to ask Trish to start with that answer.
Okay. I've worked in a partnership with UVA in the past. So I have a deep respect for the services that UVA Medical Center does provide. It was only at this point in my career that I had kind of wanted to explore the other ways that healthcare is managed. And I think one of the things that stuck out to me is the difference as a nonprofit, Sentara Medical Group and Sentara Hospital looks to kind of specialize in areas that do have some overlap with the University of Virginia, but our commitment to delivering, an excellent cutting edge services to people is quite strong. We do have individual patient rooms in the hospitals and advanced clinical services being offered. Some of the ones that we specialize in are like the cancer care, and that is the full gamut of services with cancer care, cardiac care. We have 2 emergency centers. One is an outpatient. It is located north of town at Prophet Road, which is nice so people don't have to come and go to either the medical center, here at Sentara or at UVA. If they're on the outskirts, they can often be treated up there. The birthing center and the maternity services here are one of our kind of standout services, neurology, vascular. We deal with a lot of, weight loss and nephrology, orthopedics. We're a small hospital, if you will. It's 176 beds. So that is, probably a third of the size. I think UVA is at about 270 or so. And, we continue to expand our medical and surgical services. Our volume is not near the capacity that UVA has, and that's understandable. Martha Jefferson is a hospital that has been around, physicians groups have been around with the strong community ties. And I know there is some overlap with UVA on that. And I think both of us, if I could speak for Charles for a second, are committed to providing excellent
Absolutely.
resources and healthcare to the Charlottesville and the surrounding communities, for sure.
Absolutely.
Okay, and Charles, same question.
Yeah.
What distinctions would you say there are between UVA Health and Martha Jefferson?
Yeah, absolutely. No, and Trish, yeah, no, you're more than welcome to speak with me, because I think what for me for that moment, because I think absolutely what you said is true. You know, we're both grounded in serving our community and providing quality healthcare for the community, and ensuring that we are doing what's best to be innovative and top of top of our game when it comes to providing that healthcare. So no, thank you for that, and I agree with you 100%. I want to say, Andre, some of the differences that stood out to me between Sentara and UVA, outside of the providing healthcare, I think is maybe just how we get there. So UVA is an academic medical center, to where, as I mentioned earlier, we have the 5 pillars. So the School of Nursing, School of Medicine, UPG Physicians Group, then the medical center itself, as well as our Claude Memorial Health Sciences Library. So part of what the UVA Health system, looks to do is, yes, grow that talent, develop talent, all the way through our academic programs, but use that talent to then research, right? So we have, and Trish mentioned this earlier, that she used to work in Fontaine, over that area. And I smiled because we have our Fontaine Research Center, our research park, where we do a lot of innovative things when it comes to cancer, when it comes to anything health related. But we have that research park where they're doing a lot of great things when it comes to health innovation. So I think we have, those things kind of really stand out. But in addition to that, if I look at our pediatric care right now, our children's hospital was just voted #1 for the 2nd year in a row in Virginia. So we're doing a lot of really good things there with our children's hospital center. And then we recently, acquired Novant Health up in Northern Virginia. So we're kind of adding to our map and really expanding our reach throughout Virginia, but doing a lot of great things, again, from that academic mindset, right? Being a not-for-profit, state-funded institution, our system, I think really, to me, just standing out because we are able to do so many innovative things from a research basis that really drives, strong healthcare practices, and even just, what we're doing within the hospitals with our equipment, with, our systems and processes. So from that aspect, I think that's some of the differences that really stood out. But other than that, I think Sentara, outside of the Charlottesville area, is a great hospital system. UVA, really strong, really great hospital system. And I'm proud to say that, I would love to share ideas with Tricia on things that we can do to continue practices, best practices in the area, and how we can partner. I think ultimately, at the end of the day, again, like I've said so many times, healthcare is our priority in providing quality healthcare at the end of the day. And I think we both share that commonality, when it comes to the work we do.
Well, many people
Absolutely.
think that if you work at a medical center, a hospital, that you must be working in direct patient care. And we all know that that is not true.
Right.
So I'm really interested in knowing what types of positions do you have in both direct patient care and non-patient care, just so that we can have a sense of what you two offer.
Charles, you
Go
mind
for
if
it,
I-
Trish.
Okay.
Go for it, Trish. Yeah.
So we have clinical and non-clinical services. And I think the unique thing about a healthcare entity is that it takes every department to make it run well. So
That's
I'm
right.
talking about the people that greet you when they come in the door, that give you the directions to the clinic or the floor that you're looking for. The people that run the coffee shops are quite important. The people that cook the meals and provide, nutrition and sustenance to our staff and to our patients are important. The folks that do the air conditioning repair in the middle of summer are critical to our overall comfort,
That's right.
as staff and as more primarily as patients, the folks that service our rooms and do environmental services and cleaning our facilities and making sure that we're safe and our patients are safe are all critical. So there are certainly, physician roles and LPN and RN and medical assistant roles, and patient care representatives, or you think UVA calls them patient access representatives, that are in more the face-to-face of face-to-face and daily running of the clinics, but they don't do that without the support of our environmental services folks, the groundskeeping folks that make the sidewalks clear and safe for us in the winter. And it really does take, it's one of those examples where it takes a village, to be able to run a healthcare entity of any size efficiently. So there are opportunities, and I know PVCC has programs available that offer real life, skills and electrical, apprenticeships and programs and plumbing, and all of these folks are within a healthcare setting for sure.
And thank you for that, Trish. Charles, would you concur? That's probably pretty much what happens at UVA, right?
That's absolutely true. I mean, from, as Trish mentioned, everybody from food nutrition all the way up through our facilities management team, housekeeping, things of that nature. Yeah, I mean, Trish nailed it. It takes a community, it takes a village to kind of make sure that these patients are getting through and having a very positive experience. The only position I would add to that is our IT department. I think is the one thing I would add to what you said, Trish, because as you know, from clocking in and clocking out to our HRS systems, to our healthcare systems, our Epic systems, we have to have an IT department that's in place to make sure that those systems are running and running well. Because if something goes down and we lose, something were to happen, with our software or with our programs, and somebody has to get it back up. So, having a strong IT department and individuals that are interested in IT support all the way up to IT engineering, IT software development, IT implementation. Those are all big roles as well too. And as you probably know, Andre, is that cybersecurity is also now a huge part of organizations across the nation right now. And then UVA and Sentara are no different.
Absolutely.
We have to have a team that protects us from those folks that are trying to do whatever they're doing and potentially to get in and get information that they shouldn't get, PHI, personal health information. So having a strong IT team is extremely important in this day and age. So yeah, taking everything Trish mentioned, from our greeters, our welcome team, all the way up to our physicians and in between. It takes a village to make sure that hospital systems run and they run successfully.
Great. So let's talk a little bit about what I think everybody wants to know. What positions are the greatest in demand at your facilities, and what type of openings do you have right now? Either or.
So yeah, Trish, I'll jump in quickly.
Yeah.
Because I think we're probably on the same path, even though you're the clinic
Probably.
side, but we need nurses.
Yes.
Right now, nurses are high demand. Specifically, we're looking for, and what we really want to capitalize on at this point is OR nurses. OR, emergency department nurses for the health system are critical right now. We really need to staff that area up. I think once we were able to kind of fill in some of those operating room, emergency department nursing positions, pediatrics, our children's would be another area where we're looking to really beef up our nursing population. And I say that if we were to prioritize it, nursing is top of mind right now, right? Because they are critical to the care of our patients. But going back to the question we just talked about, Andre, it takes our, medical assistants, which is also in high demand, our LPNs, extremely in high demand right now. We can't find enough LPNs at the moment. And then we work our way down to our radiology technicians. If we could find, radiology techs, that would be another area right now that, sonographers, EKGs, all those roles that are involved in the radiology departments are huge right now in high demand. So there are several areas, but, you know, leading off with RNs because they do so much, you know, RNs, you know, cover so many disciplinary, you know, areas and skill sets and provide so much support that is going to be the focus, you know, initially. But that doesn't, you know, minimize the fact that we need in other areas too. Those are just probably our biggest need right now.
Okay, thank you. And Trish?
I would absolutely agree 100% with what Charles said. There are study after study out now about the upcoming and current critical crisis as far as nursing staff and medical providers goes. And I would encourage people to, you know, however their resources are, not to limit themselves to those possibilities. If they're interested in healthcare and they can start a program, some are even starting in high school, and some programs through K-Tech, and then they can, you know, continue on through PVCC, and then, you know, don't stop your sights there, because we need people to develop to be able to take care of future generations. So what Charles said is absolutely true. It's heavy on the nursing side, and there are certainly non-patient care positions that are also critical, as we've mentioned some of them before, but the nursing side is really the one that I think causes us the most concern at this point.
Okay. Now, I know that there are some companies that offer internships. I'm not sure that you do, but I know that you have clinicals. So tell us, what are clinicals? What are they designed to do?
Trish, you want to lead off with that one?
Sure. A clinical is an in-person, now COVID had its bearing on that, so that got a little side railed, but we're back to in-person one-on-one training in a real setting. So you've gone through your didactic training, you've gone through, you know, the book training in the labs and at school, but now you're actually going to be working in the clinics or in the hospital directly with patients. And we have preceptors lined up who are the ones that are the best educators, and they help to facilitate that learning program. You have a standard of what is required for you to learn, and then they continue to just kind of develop the person's skill set. So the things that they've learned are now in practice. Things that they have, you know, and they can practice their hands-on skills. They can practice their interaction with patients, looking at what these vital signs mean or what these medical histories really do say, you know, not just a code or a statement, but what that means and how these things interact to treat the person as a whole. So clinicals are extremely important. And I think, well, I know both UVA and Sentara have some really great preceptors that will help to develop and expand the skill sets of students coming into the medical field.
All right.
Okay. Charles, that pretty much covered it?
Yeah, that really did. I don't think, again, just to add a small piece would be, you know, it does give the students the opportunity to kind of see, okay, well, where would I like to fit in? Where do I really, you know, find my passion, you know, drive? So we do like clinical rotations, which I'm sure Sentara does as well too, right? So a student can actually visit several units, right? When I say several, I'm not talking about hundreds, but you know, a few, 4 or 5, get a feeling for what each unit does, as Trish mentioned earlier, under the guidance of a preceptor, but really understand, you know, hey, you know what, I think I like, you know, children's, or I think I really like the OR. I think it gives them that hands-on experience, and really allows them the opportunity to say, okay, I could see my career flourishing here, and whether that's to start or finish. But it really, the clinical rotation, the clinicals just give the students an opportunity to really understand each environment, you know, independently, to get a feel for it. So,
okay. I'd like to remind anyone who's watching our conversation that if you have any questions or comments, please put them in the chat, and we will be looking at the chat a little bit later. So now let's talk about what can disqualify an applicant. What really makes a person go from becoming an applicant to a candidate? What can disqualify them?
On our side, we have some basic or minimum requirements on every job, description, every job application. So if you were to, you have your high level ones, which are truly knockouts, right? Your barrier crimes, which I was looking over those again today, Andre, just to kind of refresh myself. And there are 6 pages of barrier crimes.
So there are a lot of them, especially in healthcare.
It's healthcare, and that's justifiably so, because you're dealing with patient health information. It's very, it's regulated. So I was looking over those.
Explain to us what barrier crime means.
Yeah, so kind of in layman's, so a barrier crime, when you look at either felonies, misdemeanors, certain crimes that happen, in certain locations, that happen in certain settings, things that, again, that would impact, health information, or, someone who's in a healthcare setting. Basically just some examples. So if you have individuals who, whether it's a felony or a misdemeanor theft, and, to certain degrees, we would review those at a barrier crime. There's different levels of barrier crimes as well, Andre, that our onboarding team make a determination on, okay, yeah, this barrier crime, won't allow an individual to start here because. So kind of in layman's term, barrier crimes are those things that, people would commit that could be impactful if they were working in a healthcare environment, a healthcare setting, and cause some, they can see it as cause some harm, to, patients or to others working in a healthcare setting. Obviously, like gun crime, violence, theft to a certain degree. So those types of situations, criminal situations, would come up as barrier crimes. It could definitely impact somebody from getting a job, within a healthcare system.
Okay. And Trish, is there anything you want to add?
I do want to just kind of give a couple examples to add on to that. And I'm a believer in second chances, for people. And so if you, for example, were, charged with 2 DWIs, you're certainly not going to be our van transporter, in that type of thing. Now, if you did something, foolish when you were in high school and you happen to just have turned 18 and it's really not who you are at this point. We tend to look at things. We absolutely do have the same, barrier crime status as Charles was indicating, but we do tend to look at things on an individual basis. There are certainly different degrees of convictions that he was mentioning, and I would ask people to be honest when
Absolutely.
They're applying for a position. Don't not disclose, because that looks even worse. It's take ownership of that time period in your life where things went a little wrong, and prove where things aren't wrong, as you move forward in the future. But I think one of the most important things about that is to make sure people are honest in the disclosure, and then go from there.
That's right.
And barrier crimes depend upon the nature of the crime in relationship to the type of work that they'll be doing.
Right.
So, for example, if somebody has a problem with credit card fraud, you probably don't want them working in your finance department handling large sums of money.
Correct.
But one of the things, especially, one of the things especially about barrier crimes in the hospital setting, especially if it's a violent crime, it's because patients are some of the most vulnerable people.
Absolutely.
Mm-hmm.
And there's such a liability if they are injured and it's your fault. That's right.
Correct.
And Andre, just to piggyback on that, now I'm going to use my dad's example, here to why that's so important. So I mentioned earlier that my father, the reason why I moved to Virginia was to be close to my father, who was going through some health issues. And he ended up in a assisted living facility. And part of, and as he went through his, last days, and you could see just how frail he was, and as you said, vulnerable, he couldn't sit up for himself. He couldn't, feed himself. Basically, he was stricken to being in a bed all day long. But I remember one day going in and just seeing the medical assistant at the time at this assisted living facility in Northern Virginia area, who basically just tossed him down on the bed as she was trying to move him. And I don't know her background, but those are the things that you mentioned that barrier crimes want to look at. Are we going to take somebody who's had this past, whether they've changed or not, and put them in a situation where they can take advantage of individuals who, at times can't take care of themselves or can't stick up for themselves. And so the barrier crimes really help to, as you mentioned, Andre, protect the patient, protect those who may not be able to stick up for themselves or to defend themselves in certain situations. So it's really the employer's job, the healthcare organization's job to do its due diligence when it comes to those barrier crimes to try to prevent those situations from happening. And as Trish mentioned before, be honest, be upfront on the applications, because everything comes out in the end. But it also gives the employer the opportunity to, okay, what was the full scenario here? Legally, what documents do you have to support the conviction or support the accusations? Were they overturned? So, allow the process to kind of work itself out, Andre. But that all has to start with the individual being honest on the application and disclosing what they can, so that the legal team, the onboarding team, can do their due process to say, okay, yes, this individual we can move through because, legally it wasn't as bad as they disclosed in the form, or they'll come back and say, yeah, no, we can't, unfortunately, because, but allow the process to work itself out, be honest on your applications, and the right position will find those individuals eventually, but understand that the barrier crimes are there for a reason.
Exactly.
Yeah, well said, Charles.
And not just the barrier crime, not just barrier crimes are really, really important to understand about, but that's one reason why you want to have good references. So talk about what type of references an applicant should have. It shouldn't be my friend and
Right.
my mom.
Your mom, your dad.
Right.
Yeah.
So references, I like to see references from previous employers or previous coworkers, a supervisor, a coworker that is a peer is sometimes a good reference because they worked with you every single day. You may not have seen your supervisor, but 3 or 4 times a week, who knows? So I like to have that level. I also appreciate references from clinical instructors. I think they are able to speak to your work ethic and to your dedication and to your inquisitive nature, or how well you stick to a problem and figure it out, or your ability to articulate well if we're looking to hire for a person that has direct patient, contact in the front desk. And so the references I don't really get too impressed about are references from your friends. And sometimes people will put them on there.
Right.
Or they've known me a long time. Well, that they're not going to say anything bad about you, certainly. And I'm not looking for them to. I'm looking to have somebody give me the pros and cons,
Right.
type of thing. And I did want to, to let people know that even though they may not have a lot of experience or a lot of work history, there are still other people that can be references for you. If
right.
they're coming out of high school, perhaps it would be a teacher or a project that you worked on with, the IT group or the auto mechanics group, and something that actually showed what you put effort into and how you had some sticking power with it, and just a little bit about your character are also important points. I've had people give me references from church members, church groups that they're involved with, all kinds of references. I just put the lightest weight in those from friends, from true family friends.
Okay. So Charles, let's talk a little bit about interviewing.
Mhm.
How should a person prepare for an interview?
The one thing I recommend to anybody, who's going to interview for a position is research whatever organization you're going into. Research the company, research the position itself, understand the company and what they're trying to do, their goals, understand the makeup of the company. And then also research the position as well too, and how your experience, no matter how much you have, as Tricia mentioned earlier, high school students, you're not going to have a ton, but make sure you understand, why the role is relevant to the work you want to do and the work you have done. But anybody preparing for an interview, do your research, understand as much as you can the culture, ask people, questions. When I looked into UVA, I came and then did my interviews and stayed in Charlottesville for a few nights. I was talking to the bus guy over at the hotel I was staying at. I'd say, what do you think? What do you know? Tell me what, but do your homework, understand the culture as best as possible. It's always going to be a little different once you get inside, but understand the culture as much as possible. Understand, the management style as much as possible. And granted, looking into entry-level roles compared to maybe leadership roles, you might want to do a little more research, but at a foundation, understand the makeup of an organization. Understand, how many hospitals, if we're talking about UVA, or how many beds, as Tricia mentioned earlier, kind of some of the differences. What is the hospital well known for, and really show the interviewers, whoever you're meeting with, whichever hiring managers, that you did your homework.
Exactly.
That this is something you vested time in because you are truly interested in working for that employer. And that really speaks a lot, especially, I was more impressed, Andre, honestly, when I would see a young person come in, someone fresh out of high school or fresh out of college, and they could tell me, hey, you know what, IU Health, UVA, wherever you're working, wherever you're applying, I understand you all have this, or you were just in the news for this, or you just, if someone comes into an interview and they can talk to things that are happening with us as an employer, that would truly impress me. That would truly be like, wow, I know if they're doing that just to get a job, imagine what they're going to do when they're in the role, and how, they're going to want to learn about whatever, their task is. And you look at those individuals who potentially want to grow and continue to do things because they took the initiative. They took the initiative to research and find out things. So whenever you're preparing, that's my biggest recommendation. Do your research, understand, the hospital system or the organization or the employer, and then really understand the role you're applying to.
And something that I think you did not mention, but I think also is critical, is when doing your research, you need to research yourself.
Absolutely.
I mean, how do you convey to that employer that you are that best candidate? What do you have to offer? What do you bring to the table?
That's right. It's a fit both ways, Andre, right?
Yeah, it really is.
Yeah.
And I know that a lot of times, one of the first questions that the person might be asked is, well, tell me about yourself. Well, who are you?
Mm-hmm.
It's a tough question to answer if you're not prepared.
Absolutely.
It does set the bar for everything else.
Yeah.
Preparation is key, and I won't, expound too much about what Charles already had talked about. I like to have a two-way interview. I think in many cases, they're also interviewing me. They should understand not only what my explanation of the role is, but they
Mhm.
should also be able to ask some meaningful questions back to me.
Absolutely.
Like, are there
Absolutely.
opportunities for advancement? Do, just different things. I mean, do you lose a lot of employees because of, things? It depends on on the type of position, but you really want to go into a position with your eyes open. So a list of
Absolutely.
open-ended questions for the interviewer, I think, is
Right.
important. Salary is probably the least of the concerns. Most people understand what the salary range is, or the, wages when you come into a position. They have an idea, they saw it in the posting, but making sure that that's a good fit for you, and getting into a role that, has some opportunities for you if it's an entry-level role, but also opportunities to advance too.
Yeah.
That's
And
exactly right.
Trish, you made a good point. I'm sorry, Andre.
No, go ahead.
And we're starting to see, especially in this market today, we're starting to see a lot more lately. And I'm going back to the salary piece, Trish, because I think a lot of people feel like, and I get it, a lot of candidates right now feel like this is a candidate's market, and it is. Candidates have a lot of choices and a lot of options, but there's a way you handle the salary piece, and there's a way you could do it and still find out, hey, can I, and I'm talking about negotiating salaries, right? Can I get more money, or is this the best offer? I've experienced recently, especially in this market, where people feel like they're entitled to more money, and they come across that way when they're asking for more money, and they feel like, hey, you know what? As an employer, you're not giving me the best offer. I want more. I demand more. If you're asking to negotiate, do your research there as well too. Here's why I feel like I deserve more money. Here's what I think I bring to the table. Here's where I feel like I can benefit the organization, help them grow. And this is why I feel like I deserve, maybe $1 or $2 more. So yes, again, this is a candidate's market, but don't get so wrapped up in that if you really want to work for that organization, really, but you mentioned, Andre, and so did Tricia, really understand what your value is that you're bringing to the table and how you're going to benefit the company as well as how they're going to benefit you. So I think once you can speak to an interviewer, a manager, or a leader, how you're going to, use your talents, your skills to benefit that organization, that $1 or $2 or $3 you want to get in addition to what they offer, they're probably going to be a little more likely to say, okay, I love the way they presented that. I love the way they talked to us about that. I'm gonna fight for that individual to get a little bit more. But don't go in expecting that they owe you.
Right, and you have that conversation when the offer is made, not
Yeah.
before the offer is made.
Yes,
Okay?
yes.
It's putting the cart before the horse. We
Yes.
just have a few minutes left, and our chat doesn't have anyone in it right now, so I don't think
That's okay.
there will be anybody in it. But I would be remiss if I didn't ask you, what's the best way for people to apply to your facilities?
Tricia, want to lead off with that one?
Sure. So we can be found on most platforms. It's probably best to go to careers, at Sentara Health, or just sentarahealth.com to look at all of the postings, because it's not just for the Charlottesville area. It's for the locations that are closer to Richmond and onto the beach. And we even service a little bit into North Carolina as well. So I would say, you can use Indeed, you can use LinkedIn, you can use any of those platforms. The most direct route is probably just go to the Sentara.com or the SentaraCareers.com and look and see what's there.
Absolutely. And for us, Andre, I'm sorry. Yeah, I'm saying, and for us, Andre.
Yeah, go ahead.
I'm sorry, Tricia. For us, Andre, it's you can go to UVA Health, .com, or you can go to growwithuva.com, which is our career site. As Trish mentioned as well, you can find us on ZipRecruiter, Indeed, LinkedIn. You can find us. We do have a option if you go to growwithuva.com, which is we have a quick apply option there if you want to reach out to one of our recruiters and have them reach out to you within 24 hours. We have that option there as well too. But feel free to share your information with Andre for any of the students that might hear this. For anybody, if you're a student of PVCC, share your information with Andre. He can throw it over to me, and I'll make sure one of my team members gets in touch with any of the students over at PVCC as soon as possible. So But growwithuva.com, Andre, is our main career site that you can
Okay.
find our jobs.
Good to know. Thank you. And what advice would you have for anyone who's interested in working in the healthcare industry? Charles, why don't you start with that question?
I think this is going back to, Andre, no matter what it is, whether it's, patient facing or non-patient facing, but finding your purpose. I think through the pandemic, a lot of people, I think, lost that. What was my purpose of working in healthcare? I think now, at least, one of my goals is to really, look for people that have a purpose to be in healthcare and to find and understand what that purpose is. For me, it was my dad, watching his experience. For a lot of my team, and when I interview my team to come aboard, it's, so why do you want to be in healthcare? What's your purpose to being in healthcare? Because we find out those individuals, tend to last longer, in the industry. So if you have a drive and you believe strongly in healthcare because of a personal experience, maybe you were a patient at our children's hospital, or maybe you were a patient in our ER. That's purpose. That's reason. So understand your purpose, Andre. And again, whether it's a clinical position or a non-clinical position, for me, understanding your purpose is going to lead to a longer career.
Good advice. And
Yeah.
Trish?
I completely agree with what Charles has just said. You need to have something a little bit special about you to work in healthcare, and if you're a caregiver in healthcare, if you're one who's directly working with patients, you do need to have that passion and certainly some resiliency, but also some drive and some motivation to take care of folks on the days that are great and on the days that aren't so good. And also to reiterate that it does take everybody, and not necessarily just clinical people, but it takes everybody to
Absolutely.
make that patient's experience and to take care of that patient. Whether it be the folks feeding them, making sure that they get the nutrition that they need to heal. None of those roles, I think, are any less important.
Right.
So just have what your ideal is in mind, and bring your best game to work every day.
That's right.
Excellent. Well, Charles and Trish, I just want to thank you for being a part of the Healthcare Career Chat today. The wisdom that you provided is invaluable, and you're a good resource in our community. And I just want to thank you so much for sharing with us today. And I want to say to anybody who has been watching or who will be watching later on YouTube, that if you need to contact them, they've already provided the information. You can also contact me if for some reason you didn't hear what they were saying. But anyway, thank you. I will follow up with you later, and we will see you next time. Bye.
Thanks,
Thanks, Trish.
Andre.
Thanks, Andre.
Thank you.
All
now.
right, nice meeting you.
You
Nice
as well,
meeting
Trish.
you.
Take care.
Thank you.